everyone, it's Drew from Incredible Marketing here at the IM3 booth at ASAPS 2017. I'm joined by Dr. Southwick from Melbourne. Happy to have you here.
Thanks.
How's the show going so far?
Enjoying it, really enjoying it. It's always fun.
Awesome.
It's part of the calendar that I look forward to each year.
Cool. Any sessions that you've attended so far? Any new devices? Anything you're looking forward to bringing back to your patients?
I'm interested in always listening to some of my colleagues talk and see what they're doing. Always pick up one or two points here and there, and been coming to these shows for 20, 30 years, so it's a long time now.
Awesome. So this is the 50th anniversary of ASAPS, right?
Correct.
So talk to me a little bit about kind of the evolution of this society. How different is it now than it was, 20, 30 years ago?
When I first started coming here, it was back in the late 70s. So it's a long time ago now.
Okay.
And it was a small society. It was a very select group of people who were interested in aesthetic surgery. Today it's grown and mushroomed into an enormous crowd of surgeons, and a lot of the younger ones I don't know at all. Certainly the senior ones, I've seen some of them come and go. I hope I'm not going to go, but I enjoyed the coming to it.
Sure.
And I find the personalities are great. It's cool. I think one of the most important things for me is the collegiateship.
Awesome.
I know a lot of the trade people, a lot of the plastic surgeons, and I really enjoy the meeting. I pick up little pointers on various topics of aesthetic surgery which are important to take back to your practice. I also learn what not to do, which is also important, and I think when you get more experience, that's more important.
Talk to me a little bit about your practice then in Melbourne. What do you guys specialize in?
Yeah, well, I've been in practice now 38 years. It's been a wonderful journey for me. I've met a lot of wonderful people. We have about 75,000 patients in our practice.
Wow.
It's a long-standing practice, well established, and I think the most wonderful thing is the patients that come back and back to you, and you really get to know and touch their lives. I think that's been very important.
Awesome.
To me, I've also enjoyed the growth of our industry and the growth of our practice. We now have 6 plastic surgeons working together very closely. We're brothers in arms. We get on very well. We cover each other well. The communication tools are good. So it just makes practice a lot more exciting and more enjoyable. It means you can travel more and know that your patients are in good hands and they're well looked after when you're not there.
Great. Awesome. Well, let's dive into just some fun questions I'm going to ask you. Just rapid fire stuff just to learn a little more about you, okay? What's your favorite color?
Blue seems to suit me best.
Okay. Favorite sport?
I like Australian rules football. I've been intricately involved in it. I looked after clubs for 31, 32 years in the professional line.
Awesome.
And I've enjoyed that, and I've met some wonderful personalities, wonderful human beings, and seen there in this sporting activity. So Australian rules football is a tough game. I've been knocked out myself playing it, so I know what it's
So
like.
Australian rules football, are you talking about rugby or?
No, this is peculiar to Australia.
Okay.
Although it's now coming into the US and other areas, they're trying to push it into other areas.
Okay.
A little bit like combination of soccer and rugby, but you can be attacked from any angle. You don't wear any helmets unless you've been injured, which sometimes I'll force players to wear them, but generally not.
Okay.
And it's a tough, rough, but very fast sport. You need to be incredibly fit to play it, and it's got a wonderful following. Up to 100,000 people go to a big game in Melbourne. So it originated in Melbourne, my hometown, and I've followed that club, Melbourne Football Club, for a long time. Very proud to be associated with them, and that goes back 4 generations in my family. So that's pretty good fun.
That's awesome. I'm gonna have to check that out. I can't believe I haven't heard of that yet.
No, I'll send you a video.
Yeah, that'd be great. That'd be great. Awesome. Why'd you get into plastic surgery?
Plastic surgery. Well, I was interested initially in medicine because of my family situation. I had my mother very ill, and I was palmed out to live with an aunt and a grandmother on my father's side. And my aunt was a very bright young lady who went into medicine. Unfortunately, in her 4th year of medicine, she was topping each year, doing well. And in her 4th year of medicine, she was engaged to be married, and the person she was going to be married to came to my grandfather and said he wanted some money and part of his business, and he was a very strong, well-to-do man at that time. Threw him out of the house, broke up the relationship. And she had a 16-year-old sister at the time who died from kidney disease, which would be curable today. So my aunt gave up medicine, which was pretty tough. I came on the scene some years later, and I saw her get breast cancer, and she eventually died from it. And she really treated me like a second mother when my mother was seriously ill. So that really forced me into thinking, well, I want to do something better for humans.
Sure.
So I became very passionate about doing medicine. So that's what started me off into medicine. She died before I finished my final year medicine, so she never got to see me be a doctor, but I think she'd be fairly proud of me today.
Awesome. I think she would too. That's a beautiful story. Awesome. Well, any advice you would give to your previous boss?
Or my previous boss.
Previous boss, or maybe a
that's
previous.
Going back a long time. You asked me why I went into plastic surgery. I went into that because I decided to do ear, nose and throat surgery initially.
Okay.
And I found they didn't really teach anything about reconstruction, which I really enjoyed, the cancer management. So I decided to do plastic surgery on top. So I double boarded really.
Okay.
And in that process, I worked with some really wonderful surgeons. One was a surgeon from Buffalo, New York at Roswell Park Memorial Institute. Best three-dimensional surgeon I've ever worked with. Wonderful foresight into problems and clear thinking of how to get out of them. Taught me an enormous amount. So I guess he has my greatest respect.
Awesome. Okay, last question. If you could be any kind of animal, what kind of animal would you be?
An animal?
Yeah.
Well, people have likened me to a dog because it's very interesting. I just had my 20th anniversary of, it's now 23 years, but 20th anniversary of my advanced aesthetic plastic surgery workshop, which is something I started to give back to the plastic surgery community many years ago, when I was on the education panels for the Society in Australian Plastic Surgery.
Okay.
And one of the things that I've always, at the 20th anniversary, some of my well-esteemed colleagues got up and said that they thought I was very much like a dog because I was a faithful friend and I'd always stick by my friends, and I wouldn't verge from that line.
Yeah, loyalty.
Loyalty.
Well, that's good. That's a good trait to be recognized for by your friends, and a dog's a good animal to be, I guess. Dogs are my favorite animals.
Okay.
Awesome. Cool. Well, that's it. Thanks for joining us,
Okay.
and I hope you have a good rest of your show.
Thank you very much.
Thank you.